Now, doctors of the Federal Capital Territory have begun a 3-day burning strike to protest unpaid salaries, allowances, and unmet demands, specifically disrupting services across government hospitals in the state. The strike, announced by Dr. George Ebong, the president of the Association of Resident Doctors of the FCTA, follows the expiration of a 3-week ultimatum issued to the government last year. The doctors are demanding payment of 6 months unpaid salaries, improved working conditions, and better welfare packages. They also lamented the deplorable state of hospitals in Abuja, citing lack of equipment, manpower, and basic amenities such as electricity. Dr. Ebong challenged the FCT Minister, Nyesom Wike, and the Senate President, Godswill Akpabio, to use government hospitals in Abuja to experience the challenges firsthand faced by healthcare workers and patients. He emphasized that public office holders should prioritize the welfare of healthcare workers and the development of public healthcare facilities. The strike has affected hospitals in key areas, including Wuse, Asokoro, Maitama, Kubwa, Zuba, Kwali, Abaji, and Nyanya. The doctors have threatened to embark on an indefinite strike if their demands are not met. Now joining me on the program to discuss this is Dr. Oshundaya Tokwe. He is the president of the Nigerian Association of Resident Doctors. He joins virtually from Abuja. Thank you for your time.
You're welcome, sir.
All right, let me start by asking you, the reason for this strike. What are your specific reservations, concerns, and demands?
Thank you very much. Most of the demands borders on the emoluments and the remuneration of our doctors. And at this time, looking at how the economic downturn of the country is, it would be unfair to tell doctors who are hungry to still continue to work. An hungry doctor can also be an angry doctor. And when emotions are high, you are not catering for their welfare, you should not even expect that the working condition of some of these doctors will be smooth. And to avert clashes between doctors and the patients, I think the onus lies on government and every other stakeholder to look into these issues of welfare. We all know that the welfare condition of an average Nigerian doctor is not as par with what is obtained abroad. And it is one of the reasons why we have coined a name called Japa syndrome. In fact, Japa syndrome seems to be a name or a syndrome accepted all over the world. And, in some climes, they found it to even include it in some of articles and journals, and people are beginning to review the push and pull factors of Japa.
I mean, before we even get into the old Japa syndrome, which we know that the medical sector is hugely, particularly in Nigeria, is hugely impacted. Can you just give us an idea of what the current welfare package of an average doctor, maybe in a government hospital, what's the welfare package like? What's the take home, for a doctor?
For obvious reasons, I would not want to...
You might just want to give a range. The reason is this, so that Nigerians have an idea of what exactly it is you're going through. You might not give specifics, but you may give a range.
Okay. It varies, but averagely, the lowest cadre of the medical profession takes home something in the region of 2 to 250,000 naira.
That's monthly.
Yes, monthly.
Okay. Say maybe a graduate or resident doctor, should go with something a bit higher. But compared to what is obtainable internationally, that's still relatively small, given the current economic situation. So, like, how many, in terms of the arrears of salaries being owed, how many months are we looking at for the FCT?
For some of the residents in FCTA, and some of these doctors work in several general hospitals in Abuja. Some of them since 2023, they have been owed arrears of 1 to 6 months.
1 to 6 months. 6 months.
Yes, that's since 2023. While we also have upward review of commerce. The commerce salary scale, which is the salary scale for doctors, has been reviewed upward to 25%. And since the employment in 2023, most of the doctors have not been given this upward review. And it is for this reason the association deems it right to call stakeholders to negotiation table to discuss this matter, which has been ongoing since last year. 21-day ultimatum was given before another ultimatum was given. And despite this ultimatum, the response of the government and other stakeholders, especially from the Minister of FCT, that's Barrister Wilson Wike, it has not been, cordial, and we've not enjoyed that, good relationship in terms of when it comes to negotiation, so that we can avert some of these crises. It is not a thing of pleasure for us to down tool or to have an industrial disharmony with our employers. But because of the current situation of things and the attitude of government to some of these negotiations, which has caused the breakdown, that's why we have taken it upon ourselves to go on industrial disarmament.
And I mean, looking at the fact that some of these arrears span as high, as 6 months, one would but wonder how, your colleagues that, are affected, how they survive. So my next question is this. Let's talk about the working condition itself in many of these hospitals. Can you just give us a grim idea of what, the tools or the working condition is like, in the FCT?
All right. First of all, I would want to say that, the workforce, the strength of workforce, especially for doctors working in FCT, has dwindled because most of our members, they found a way to go to greener pastures, and the government is not, doing adequately enough to ensure that there is improvement in that workforce. Coupled with the fact that there are still areas of lack in terms of the needed equipment and the available materials to work effectively within the hospital. The working condition is still suboptimal. We are believing that the Minister of FCT will look into this and optimize this working condition, especially the fact that we have our doctors who have been strained. The workforce, the strength of doctors in FCT is not adequate. So they need more employment of doctors. There are several doctors who are still looking for ways of getting into the service getting into employment, but since there is no advert for employment, it is not possible for them to just.
I'm sorry. So just to understand the scenario, you said there is part of the challenges is that there is a shortage in workforce, and you also said that there are doctors who want to also even come into the workforce, but there has not been any form of advertisement for. So it's not a situation of lack of skilled personnel. It's a situation of employing more hands.
Exactly.
So what? Okay, let me allow you to talk.
Yeah, so just to reiterate what you've said, the skilled workers, health workers are out there, but you actually need the government to throw an advert out there so that they can apply and come into the workforce. But this has not been done yet, and we are hoping that it could be it could be attended to, and they could give it priority so that more people can be employed into the workforce, and that would reduce this burnout effect that it's having on our doctors.
Okay. At this point, we'll go on a quick break. When we return, we'll talk about efforts that you have made to call the attention of the FCT minister, because, I mean, for many Nigerians, they will say he's a man known as Mr. Project, and he seems to have embarked on quite a number of projects in the FCT, and one would wonder, if at all, what's going on within the medical space there. But we'll discuss this and more when we return. Stay with us. Many thanks for staying with us. This, of course, is still Politics HQ on New Central Television, and we are looking at, of course, issues around the medical space in Abuja, where doctors have down tools demanding attention be given to them in terms of their welfare, conditions of service, amongst other issues. I still have my guest with me. He's the president of Nigerian Association of Resident Doctors, Dr. Osundara Tokwe. He joins virtually. Thank you for staying with me, sir. Now, before we went on that break, I did say that the current minister of the FCT, in person of His Excellency Wike, seems to be a man of projects. He has unveiled quite a couple of projects in the FCT, and he has completed quite a few. So one would wonder what's going on within the medical space. Have you made efforts to initiate, meetings or call the attention of the minister? And what has been the response, if at all, so far?
All right. The attention of His Excellency Wike has been called and is fully aware of this matter. Likewise, the hospital management in FCTA, they are also very much aware. And there has been roundtable talk, but when you come to a discussion and all that you get is it just stops at the table of that discussion. There is no further active or proactive ways of carrying out whatsoever the resolution of that discussions are. This lack of following through with the resolution will cause breakdown in whatsoever you've established prior. And, several meetings, like I mentioned the other time, we gave a 21-day ultimatum earlier, which was even extended. And you will not blame anybody for, after a 21-day ultimatum has been given and there was no, logical resolution of anything forthcoming out of the gamut of issues that we have before them. There is this issue of MRTF, that's the Medical Residency Training Fund, which is also there. There's an issue of apportionment allowance. Other health workers, especially the nurses, they were able to get their uniform allowance and doctors are saying the apportionment allowance for 2024 has not been paid. MRTF 2024, we have about 75 residents in FCTA, and this money is just to cushion for the exams, for the training as a resident. A resident doctor is someone who is under tutelage or training to become a consultant or a specialist in a particular field of medicine. And there are several things that accompanies this training. So this cushioning effect is what we're asking the government to do, like it's been done all over the country. Even states, tertiary institutions are doing it. So it's untoward when you are discussing that FCT, as big as they are, they could not even pay for 2024 MRTF. Now we are in 2025. Now, if you've not paid for 2024, what becomes of 2025? So it is for these reasons that we've called their attention. We've had several meetings at several forums and nothing concrete has really been done.
But was there any form of commitment on the part of the government?
Yeah, if
maybe
there are
written
of course,
commitments.
we'll not-
Yeah.
No, there's nothing like a written commitment anyway.
So it was
If there is
just
a written commitment, there should be a deadline to that written commitment. Either written commitment or a deadline to the written commitment has not been made available.
so it was just talks, but no
Exactly.
no specific commitment whatsoever.
Yes.
This strike or this warning strike, I mean, you're saying it's 3 days. Should
Yes.
the attention of the government, not be, I mean, should they not bulge? What next?
Well, that decision will be taken by the Congress of ALDFCT. Members of the Congress will examine and re-examine the situation, will table everything before them, what we've gained so far during this during the period of the 3-day warning strike, and we'll see what the next action will be. And it is the Congress that will direct us exactly on what to do. It is not going to be the decision, my own decision, neither will it be the decision of Dr. George, who is the president of ALDFCTA. It will be a Congress decision, and it is going to be unanimous. So whatever that decision will be communicated accordingly.
Are there plans to escalate this to the presidency?
Well, we are in talks with some members of House of Representatives. Several meetings have been arranged, and we'll see what the outcome of these meetings will be. We believe that this thing can be contained, and those who can easily reach out to the minister will do so. And I do not think that everything should be thrown. There's a whole lot of things that is at the table of the president of the country, His Excellency President Bola Ahmed Tinubu. But if need be, that will reach out to him. Definitely we are going to reach out to him, because we are not planning to make Nigerians suffer the more. We are also keen into the renewed hope agenda. And the renewed hope agenda also entails giving adequate quality care to Nigerians, especially those in Abuja, which is the Federal Capital Territory of the country. So if we are having industrial disharmony, how do we establish this renewed hope agenda? So it will be appalling to see that because of issues that could easily be handled, we are now having disintegration, and the renewed hope agenda becomes another thing for Nigeria. So if there will be a need for us to actually reach out to the president, definitely we are going to do that. But for now, we are still trying to, talk to every other stakeholders, talk to every other person that could easily help us reach out to the Honorable Minister, so that things can be done and curtailed within our means.
All right, we'll go on another break. This time around, when we return, we'll expand this conversation to look at welfare generally of Nigerian doctors, vis-a-vis what is obtainable in other countries globally. Stay with us. We'll be right back. Many thanks for staying with us. Of course, this is still Politics HQ on News Central Television. And today we are talking about the 3-day warning strike resident doctors in Abuja have embarked on to call the attention of the government to their welfare and the atmosphere of work. I still have with me on the program Dr. Oshundara Tokwe. He is the president of Nigerian Association of Resident Doctors. Thank you for staying with me, Dr. Oshundara. Now, just permit me to give a bit of breakdown as regards, based on the information available to me, how much, people in the medical space are paid, across the world. For instance, in Luxembourg, in the US, in Netherlands, specialists are paid as high as over $300,000, while general practitioners as high as over $200,000. This, of course, the difference in countries like Australia, Germany, even Austria, Belgium, and Canada, the difference is just maybe minimal. But when you bring it down to Nigeria, just like what you said the minimum amount a doctor takes home is, that's at the lowest cadre. You said about 200, 250. One would look at this vis-a-vis the cost of living at the moment. you have rent, you have feeding, which takes a bulk. You have, if you are a family man, you have to cater for your family and all of that. And then you talk about the Japa syndrome here. For many individuals, there's passion, but then there's the reality. I'd like you to speak more on the issue of Japa syndrome and how it has affected your practice and that of your colleagues as a doctor, those of you who are still in the country.
We can't shy away from the fact that there is an abysmal poor remuneration for doctors and every other health workers in the country. And this is one of the, push factor that is making people to leave the country in droves. And if something is not done to curtail this or to forestall this Japa syndrome, we'll keep having doctors leaving the shores of this country. Remuneration is a key factor to what can better the life of a doctor, because a doctor is more or less like a breadwinner in a family. So there is a whole lot of pressure on a doctor. Aside that, especially for people in residency, residency is tasking, and residency has a way of having its toll, because you need to go for research. Aside the training that you are doing, you are rendering service, you are rendering research, and a whole lot more during your residency program. So whatsoever the government is giving us is even, compared to what is obtainable outside there or out in the other developed country, we are not requesting that they should be at par with all those countries, but at least there should be a significant improvement in what should be paid to doctors and every other health workers. And this is one of the reasons why we keep having this Japa syndrome. The Honorable Coordinating Minister for State for Health and Social Welfare drew up a plan to also improve the remuneration for doctors and for every other health workers. But the effect, we've not seen it till now. Even the minimum wage that was done, we just have a flat rate for everybody. Consequential adjustment in this minimum wage has not been done till now, and which is one of the reasons why people cannot keep enduring it.
Sorry, I want you to take that again. You said consequential adjustment with the new minimum wage has not been effected, meaning that doctors are still being paid the old rate, not the reviewed 70,000 naira minimum wage, which is meant to, of course, have a ripple effect. Is that what you're saying?
Yes, it should have its own effect based on, collective bargaining agreements we had with the government sometimes in 2019. But, what we just had was that a lump sum of about 40,000 naira was just added to salary, and that was what they call minimum wage.
Wait, a lump sum of how much? 40,000 naira was just added?
Yes.
And then that concluded their review?
Exactly.
Interesting. Still on this issue, we know that at some point the Nigerian government was sort of taking steps to address the brain drain of doctors, which many Nigerians considered, futile. We know that some proposals like, if you are trained here, you should stay here for a while. The government can't spend money on you and all of that. But my question is this. Does the government in a way even have a right to say, as a doctor, you can't leave the country? Given
No.
Okay, as an association, I want you to respond to this.
All right. Leaving the country, the shores of Nigeria, is not peculiar to doctors alone. There are several other associations, other workers in other fields in the country where you have some of them leaving the country and they are not under any bond. What you are trying to infer is just this issue of bonding a doctor because the government is doing this or doing that. We are not the only set of individuals that has been trained, by the Nigerian government. We have other students before they became professionals in their field who also enjoyed this, largesse from the government. We are not saying that they've not done well. They've done well in that aspect, but they've not bound anybody or put them under any hoods because there is this subvention from the government. And it's untoward and ignoble if the government is going to be placing a bond on Nigerians or on Nigerian doctor. It is something strange even to the law. And as an association, we are not going to take that.
An interesting angle to the speech of the statement by the, of course, Association of Resident Doctors doing this warning strike is that you also beaconed that the Minister of the FCT and even the Senate President and maybe even other public office holders should patronize and use local hospitals so that they can have first-hand experience, of what the working condition is like for both the workers and the patients. I'd like you to speak on this.
Thank you very much. This issue of going abroad to seek medical attention.
What some call medical tourism.
Yeah, medical tourism. It's something that one way or the other we should find a law that will abolish it. If we have the who is who in this country patronizing our hospitals, it will improve, the state of those hospitals because, of course, you don't want to have a governor visit your hospital and you want to put that governor in a shabby environment. So it will improve. In fact, when governors and the who is who, when they come to our facility and they see that this facility is in shambles, it will also, drive them to also improve on the state of that facility. Some of them have been trying to improve. We have places where sometimes we don't have MRI. In fact, in most states, you hardly will find a functional MRI. And this MRI is, part of what we need for radiological investigation. We have, we have the CT scan too. We need those things for radiological investigation so that it can improve patient outcome when you are treating them. So I believe that if government functionaries are patronizing our hospitals, despite apart from the improvement that we are going to have in terms of state-of-the-art facility, it will also improve our economy. So the money we are taking for tourism to go and better the welfare or the economic states of those countries, we can pump it into Nigeria. If you are going to go to a place like maybe India or Germany for medical treatment, of course, you are going to use their flights down to the country. You are going to use several of their amenities before you even get to see, before you get to the medical facility over there. So some of this money that you are taking down to overseas countries is something you can actually bring down to Nigeria to improve the state of our facility or the state of our healthcare system. So medical tourism is something that the government really needs to work on so that we prioritize our own health system here rather than prioritizing what we have abroad. We have the personnel, we have doctors and certified doctors, well-acclaimed, well-known doctors over the country who can do, in fact, very much better than what they are doing abroad. And, there is enough testimony to, support this very statement of mine.
All right, we'll go on another break. When we definitely return, we'll also look at what the budget says, is going to the health sector vis-a-vis, other sectors which are equally critical. Do stay with us. We'll be right back. Many thanks for staying with us. Of course, this is still Politics HQ on News Central TV, and we are talking about the 3-day warning strike by resident doctors in Abuja. Well, earlier today, we had an analyst who spoke on this strike and its implications. Listen to Jide Ojo. We'll be right back.
You know what? The implication of even shutting down public hospital for one day is very great. Patients will have died. Many will have had to compulsorily take their patients to private hospitals where they will pay huge sums of money. That means access to affordable Medicare will be denied in the next 72 hours while this strike lasts. And I'm really surprised because for those of us living in Abuja, we have seen the yeoman's job that Minister Nyesom Wike is doing in the area of infrastructure, particularly road infrastructure. I wonder why is just indifferent to the plight of Nigerian resident doctors who have no water, no light, a whole salaries, backlog of 1 to 6 months salary. The state of healthcare services in Abuja and FCT in general has deteriorated to the extent that they can even call upon the minister and the president of Senate and even the president to use public hospital and see how bad things have been.
I mean, there, of course, you just had Jide Ojo, a public analyst who spoke on this issue, saying that it's important that Nigeria and Nigeria's government pay attention to the health sector. I still have Dr. Oshundara Tokwe, as the president of the Nigeria Association of Resident Doctors, with me on the program. I would like to believe that you had what Jide Ojo said in that sound on tape, pretty much not different from what you have actually highlighted, in the course of the program. But I would also want to speak on the 2025 budget allocation to the health sector. About 2.48 trillion naira, has been budgeted for that sector, which covers about 5.18% of the entire budget. We know that a breakdown of that should have about 2.65 billion naira going to basic health care provision fund, and about 402 billion naira into health infrastructure. I would like to ask you, how much of impact do you think, if at all, this might have on the health sector, given the fact that even though we know that this monetary increase, from the 2024 budget, the proportion allocation, to health falls short by 15%, a benchmark sent by the, Abuja Declaration of 2001. How much of impact do you think this current allocation will have, on the health space?
Just like you mentioned, right here in Nigeria, in Abuja in 2001, there was an Abuja Declaration that says 15% of the proposed spending, the budget for the year, should be allocated to health. This is not even up to what we have as the current spending that will be for health in our 2025 budget is just about 6%, which is even not even up to half. And you can just imagine if there is a proposal, even WHO says 13% should be for health out of what the spending of the fiscal year should be. And unfortunately, we also have a very big problem, which we don't know how it's going to pan out. The president of the United States of America withdrawing its own support for WHO. So that will leave Africa, especially Africa with Nigerians that are dependent on, drugs, vaccines, and more. And if you do not have this support structure from countries like US, that will mean that your funding for health should increase. And we already have 6%, which is a far cry from what Abuja Declaration has been. So it's going to have its negative impact on the health system of the country. Of course, we have other sector within the health system, the private sector. Government is also looking into establishing a private partnership and other multinationals so that it can cushion this effect. But what we should be doing as a country is, like I said, is still suboptimal. And I believe that there should be a better improvement. Of course, at some point, I think maybe about 3-4 years ago, the budgetary allocation for health was about 4%. At some point, it increased to 5%. We've gradually seen it close to 6% now, though this 6% is still a far cry from what the ideal should be. So there is no amount of talks or conversation we are going to have if the budgeting and the funding for health is not adequate. It is going to leave a whole lot of lacuna in the space.
I mean, before I let you go, there's also this talk, global talk about AI. Even though I know it's off, our core conversation tonight, but I feel it's important I bring it up because we know that since the United States, had a new administration, just I think yesterday there was a $500 billion commitment into AI funding. So there's a lot of talk, about AI across sectors, especially the medical space. In Nigeria, how feasible is this? And as a doctor, do you see AI threatening your job or making you better at it?
AI cannot threaten the job of a doctor. We already have, in fact, the essence of technology is to complement the work of a doctor. And AI is a welcome development. We already have in Nigeria a telemedicine, which is more or less like what the AI will do, so that you use the improvement of technology to attend to the healthcare need of our patient or of our client. So AI will not threaten the work of a doctor, it will only complement it. Of course, there will still be a need for physical presence of a doctor to attend to a patient, but definitely the AI is just there to complement. And I think if Nigeria should be able to key into this, it will also go a long way to help us as a country in our healthcare delivery.
All right, before I let you go, what would be your, parting words to the Minister of the FCT and the federal government at large as regards this strike?
All right. Of course, our doors are open for negotiation and for further discussion. But we do not want to just have these discussions and negotiations without implementation of whatsoever the agreed resolutions are. So because we don't want to be going back, just like the other guests mentioned, that shutting down the hospital just for a day had a significant impact on so many people, and we have a fragile healthcare system. So shutting down the hospital is not good for us as doctors, neither is it good for Nigerians who we have been saddled with the responsibility of taking care of their health. So my appeal to the government and to every other stakeholder within the health system, including the Honorable Minister for FCT, that's His Excellency Barrister Wike, please, we want you to help us look into this and make it a priority, because it's a burning issue for us. And whatsoever can be done to ensure that we return back to work and there is no any further delay or decline in whatsoever the agreements are, I would want you to please ensure that this is done. We call on every other Nigerians who can easily reach out to the Senate President, reach out to the Minister himself, reach out to Professor Ali Pate, who is the Coordinating Minister for State for Health and Social Welfare, and the Honorable Minister for Health and Social Welfare, that's Dr. Isaac Adekunle Salako. All these, people within the corridor of power, we should reach out to them as Nigerians so that adequate provision can be made for the welfare of our doctors in FCT and across the country.
Dr. Shundara Tokbe, President, Nigerian Association of Resident Doctors, thank you so much for your time on the program.
It's a pleasure here, sir.
All right. And of course, at this point, this is where we drop the curtains. In case you missed out, you can actually catch up on our YouTube platform. That's at News Central TV. You can also choose to follow us across social media. The handle is on the screen. You can also choose to follow me personally at Dakbo Adigboye. There will be a repeat broadcast tonight, so you might also want to catch up for that. Till I come your way tomorrow, good night.